good health care now. There's no doubt we need reforms. Though this is more of an educational meeting and not necessarily talking about our opinions on what can be done better, I would like to hear a little bit about your opinion and how we can do better under today's system, as opposed to maybe what this president is trying to jam down our throats.
Well, again, I'd like to reiterate what's been said, and that is the desolation that we've had with primary care. Why do you think there's not enough primary care doctors? It's because we work too hard? No. It's very simple. They can't make it. Why would you want to incur all that cost, but you can't thrive? The system doesn't support it. And it's again like everything we do in Washington, in a way, just to make us all dependent more on the government, more on everybody else, instead of being self-sufficient. And like I said earlier, our system does best when you have the power. And so I want to give you the power. I really think that if you want to shop for insurance, why are we restricted just in Illinois? Why can't we shop across state lines and get the best rate, like other insurance entities might be for other things?
Right, I interrupt you, that's a great point, and I'm not sure how many people here understand that it's our law here. That's something that you need to, if you don't mind explaining to the public here what you just talked about in regards to competition with insurance companies.
I mean, as far as our state law in Illinois, you know, they don't have any antitrust violations at all, whereas physicians do. They can really charge what they want, and they can collaborate with other insurance companies and merge and then charge the premiums that they really want to really charge. And you can't go across state lines and get that same kind of coverage for a cheaper rate. Second, I think we ought to make it that insurance is mobile, just like your car insurance is. If you buy a new car, do you lose your insurance? No. So if I have a new job, do I have to lose my insurance? Yes. Well, that shouldn't be. I should be able to take that with me. And there should be mobility in what we have. So you have mobility and you have the power to pick and choose now. You're not completely dependent on your employer as to what insurance you have to have. You should be able to shop it out, and if you've got the capital and you want to buy a better premium, then God bless you. Buy it. The other thing I think we should have it is that more of the initial dollars you should be paying. I don't think it's a good idea that you have a $10 copay. I really think you should have more of it, but get what you can afford. I have people coming to me saying, I want my MRI. Well, that makes costs go up. Why? Because they just have to pay a $20 copay. Well, that ain't right. If they had more responsibility, they had to pay that first $5,000. They may not buy that LASIK surgery. They may not get that MRI. Costs go down. So we need to make people more physically responsible. And we do that by putting the power back in their hands. You guys are not children. You guys are not babies. You don't need the government to be your mommy and daddy. You can run this. With your physician, it can be done. Thank you, guys.
Mr. Ladd, this next question is directed to you. In your opinion, do we face a danger in not doing anything to reform our healthcare system? And what is the greatest danger we face in the prospects of needed change?
Well, first of all, I don't think there's any question. I think anybody in this room that has heard this tonight knows that there is a real danger of not doing anything, and that is bankruptcy. I mean, that's where it's going in the current system. You have heard tonight about co-pays. You've heard about people being involved in control of their health care.
Could you speak into the microphone?
I'm sorry, excuse me. You've heard about co-pays and you're being involved in your own health care, and if you have a financial stake in that decision, you will consider it differently than if it doesn't cost you anything. Now, let's just talk about some of the things that can happen. There is an article published by Johns Hopkins that says roughly half of the nation's approximately $300 billion in annual drug spending is currently wasted. And why is it wasted? Because these drugs don't work on a lot of people. Does the average doctor know that? No, he can't know that. Can we find out? Yes, we can. There's something called the Human Genome Project, and we're this close now to getting a complete genetic sequence on each one of us for $1,000. Once you've got that, he knows my family history, he knows me, knows the kind of job I'm in, the stress. He can then predict what my likely problems are throughout life and prescribe diet, regimen, lifestyle that will keep me healthy. And we ought to pay him to keep me healthy. That's what this is all about. We're now paying on volume for sick people. Let's pay people to keep us well. But we have a responsibility to be involved in that. And that means that once we go to that emergency room, we shouldn't be paying $10. We should be paying $250 or $500 because it's a real expensive thing. And this is the problem with Medicaid. Most people are presenting themselves to the healthcare delivery system in the emergency room, as I heard earlier. That's a huge charge. It's a very costly thing. And they ought not to be able to do that. If they want insurance, they ought to be assigned to some physician in some part of an HMO program, and they go through the same thing everybody else does. There are real ways to start cutting costs here without doing what this president's talking about.